Vagus only supplies the ear and the meninges, and it supplies the trachea, bronchi, GI tract up to right 2/3 of transverse colon and the external ear, of course. The spinal root of accessory supplies only two muscles in the neck, the chin turning sternocleidomastoid and the shrugging muscle, the shrugging muscle, the trapezius, and the chin turning muscle, the sternocleidomastoid muscle. The hypoglossal nerve supplies 7 out of 8 muscles on each side of the tongue, all the intrinsic muscle, all 4 intrinsic muscle, and 3 out of 4 extrinsic muscle. Only one muscle is supplied by the vago-accessory complex. This is summary of all the 12 cranial nerves, and we can see the attachment. Here is the olfactory nerve. This is optic nerve forming optic chiasma, third nerve, fourth nerve, fifth in relation at the junction of pons and medulla, function of pons and middle cerebellar peduncle, sixth at the upper border of pyramid, seventh and eighth on the lateral side, 9th, 10th, and 11th between olive and inferior cerebellar peduncle, and 12th nerve between pyramid and olive. Now we come to each of the nerves. The olfactory nerve receptors are present in the olfactory mucosa, which is present in upper 6 to 8 millimeters of the nasal septum and the lateral wall of the nose. And these are the ones, the olfactory receptor cells are there. From there, we have the olfactory nerve rootlets, which are 12 to 15 in number. They pierce this cribriform plate of ethmoid, in the anterior cranial fossa, and they form olfactory bulb. From the olfactory bulb, we have the olfactory tract and the stria. The lateral stria, olfactory stria, is the main one which carries the sense of smell. It ends in a anterior perforated and ends in the anterior perforated substance, and finally from there it goes to secondary olfactory cortex, which is known as the uncus. So this is the pathway for sense of smell. This is the one which is not passing through the region of the thalamus. And one can test is, if the sense of smell is not proper, the condition is known as anosmia. We test the sense of smell by putting cotton dipped in ammonia. The second cranial nerve is the optic nerve. Optic nerve is a very special sense. We have the visual field, and we say to the patient about the visual field. From the visual field, impulses go to the retina, and the light travels in a straight line. Retina are bent forwards and medially. This is the temporal part of the retina. And here is the nasal part of the retina, the temporal part of the retina on the left side, the nasal part of the retina. So the impulses, and human vision is binocular, human vision is stereoscopic, human vision is colorful. So we can see the height, the width, and the thickness of the person or an object. So human vision is very special. And from there, the light travels in a straight line. They come to the nasal field. From the temporal field, they come to the nasal field of retina. And from the nasal field is different and retina is different. From the nasal field, they come to the temporal field of retina. Binocular vision, that means the eye sees most of the vision is binocular, only partly it is the monoocular vision on the right side and monoocular vision on the left side. From there, the impulses are traveling via a special nerve, the second cranial nerve, which is the optic nerve. In the optic nerve, fibers travel. The nasal fibers from the retina, they cross, so that you can see the red and blue fibers crossing, red from the right eye and blue from the left eye, they cross. And the temporal fibers do not cross. And this is known as optic chiasma. Optic chiasma, the fibers, nasal fibers of the right eye and nasal fibers of the left eye, they cross. And this optic chiasma is lying in relation to the pituitary gland or the hypophysis cerebri. If pituitary gland enlarges, it may press upon the optic chiasma and cause symptoms. Then from the optic chiasma, the fibers go backwards in the optic tract. So that both the blues go to the right side from the picture diagram point of view, and both the reds go to the left side. They relay in a special body which is known as lateral geniculate body. Here the fibers relay fibers from the ipsilateral retina and fibers from the contralateral retina, and these fibers, they form optic radiations. And in the optic radiation, these fibers travel backwards in the occipital lobe of the cerebral cortex, where we have sense of illumination, light, color. All these sensations are understood in the occipital lobe. And though we are seeing with both the eyes, but the object is only one, and the object becomes straight as we see in the occipital cortex. So this is a special sense. The first neurons are there in the retina, and then they relay in the lateral geniculate body and form optic radiation. This Mayer's loop is there. Some of the fibers, they go to the temporal lobe and then come down to the occipital lobe. Occipital lobe is the center for vision. Eye are placed anteriorly, but their understanding or their meaning is lying at the posterior part of the brain, which is the occipital lobe, and which is lying above the cerebellum. And this is area 17, 18, and 19. Coming to the next nerve, the third nerve. The third nerve is the oculomotor. Oculomotor means it is motor to the most of the muscles of the eyeball, the extraocular muscles. The components of this are the general somatic efferent column, the most medial column, general visceral efferent. General visceral efferent means it is the nucleus which is the Edinger-Westphal nucleus, and this is the nucleus which is special in relation to the third nerve. And general somatic efferent, the proprioceptive impulses from these muscles of the eyeball are carried in the mesencephalic nucleus. Edinger-Westphal nucleus is a special nucleus only in relation to the third nerve, not in relation to the fourth nerve or the sixth nerve. It emerges on the medial side. It emerges on the medial side of the red nucleus, passes through the red nucleus, and this is the nerve. It is passing in between the superior cerebellar artery and the posterior cerebral artery, passes through the cavernous sinus, passes through superior orbital fissure. This is the superior orbital fissure. This is the superior orbital fissure lying between the anterior cranial fossa and the middle cranial fossa. There are various important structures which are passing through this, through the superior orbital fissure. The lacrimal, frontal, trochlear, upper division of oculomotor, nasociliary, lower division of oculomotor, and the abducent nerve. And as these nerves, we are only showing in this diagram the third nerve. It divides into a upper division and a larger lower division. Upper division supplies levator palpebrae superioris and superior rectus. Lower division supplies medial rectus, inferior oblique. The nerve to inferior oblique is giving a branch to ciliary ganglia. And this particular branch is the one which is coming from the Edinger-Westphal nucleus. This particular branch comes from Edinger Westport nucleus, and it relays in the ciliary ganglia to supply the ciliary muscles and the sphincter pupillae muscle. Sphincter pupillae narrows the size of the pupil from this size to this size, and the ciliary muscle increase the convexity of the lens, so that the images can be seen, and so that these two muscles are the ones which are used for accommodation. If third nerve is paralyzed, the eye goes downwards and laterally under the over effect of the fourth cranial nerve and the sixth cranial nerve. The third nerve is very important. It supplies 4.5 muscles of the out of the extraocular muscles, and it also supplies the intraocular muscles. The intraocular muscle is the sphincter pupillae, which is the parasympathetic supplied, and the ciliary muscle, which are also supplied by parasympathetic nervous system. So parasympathetic nervous system is the nerve for accommodation. While we are reading, it is the parasympathetic nerve which is actually functioning. Coming to the fourth nerve, the trochlear nerve, the nuclear column is general somatic efferent, same as the third nerve, and this nucleus is situated at the level of midbrain and at inferior colliculus of midbrain, and the efferents from this single nucleus go to same nucleus as the mesencephalic nucleus of the trigeminal nerve. So it has only got two columns. There is no column general visceral efferent because it does not supply the ciliary ganglia. It is the very delicate nerve. It is the only nerve which has a dorsal attachment. It goes around the midbrain, lies between superior cerebellar artery and posterior cerebral artery, passes through cavernous sinus, passes through superior orbital fissure, and supplies the supplies this superior oblique muscle. Superior oblique muscle, though it is lying on the medial side, but it gets inserted into the posterior part of the eyeball. This is the superior orbital fissure through which the third nerve is also passing. This is the superior orbital fissure through which third nerve, fourth nerve, and sixth nerve, they pass from the middle cranial fossa into the region of the eyeball. This is the superior orbital fissure. Coming to the sixth nerve, we'll do the fifth nerve later. Since the sixth nerve is also supplying the extraocular muscle, it is better to do third, fourth, and sixth nerve together. This also belongs to general somatic efferent column, as the third and fourth nerve are there, and the general somatic efferent, the mesencephalic nucleus. So the nuclear columns of fourth and sixth are absolutely common. It arises in relation to the pons, passes through the pons, passes through the cavernous sinus in a special canal, passes through superior orbital fissure, and passes through cavernous sinus within a special canal which is known as the Doral's canal, passes through superior orbital fissure, and supplies the lateral rectus muscle. This is one of the muscle which is very, very richly supplied by nerve. The muscle ratio and nerve ratio is very less. One nerve fiber will supply about 5 to 10 muscle fibers only. So this is a very important and very accurate muscle. So this is the sixth nerve. If sixth nerve is injured, the medial squint is there and diplopia is there. person sees two objects instead of one. Coming to the fifth nerve is the largest nerve which has maximum distribution, the nuclear column. Nuclear column in this are the branchial efferent column, which is special because these muscles develop from the first arch. First branchial arch or first pharyngeal arch gives rise to 4 muscles of mastication: temporalis, masseter, medial and lateral pterygoid, and 4 other muscles: the anterior belly of digastric, mylohyoid, tensor parietii, and tensor tympani. All these 8 muscles are innervated by the fifth nerve. The general somatic efferent column has got 3 subnuclei. One is the mesencephalic nucleus in the midbrain, which is carrying the proprioceptive impulses, and other is the main sensory nucleus, which carries pain and temperature, and third is the spinal nucleus, which the main sensory nucleus, which is carrying touch and pressure, and spinal nucleus of trigeminal, which is carrying pain and temperature. Here, this is the nucleus is lying in relation to the pons and in relation to the cave. Here, this part at the apex of the petrous temporal bone, on the ventral surface of the petrous temporal bone, there is the trigeminal ganglia, and the Meckel's cave is there, and from the trigeminal ganglia, there are 3 branches: ophthalmic, maxillary nerve, and the mandibular nerve. Ophthalmic nerve is sensory, maxillary nerve is sensory, and mandibular nerve is motor. Here we can see these nuclear columns. The motor nucleus of the fifth nerve, which is supplying the muscles. The only tract is the mesencephalic nucleus, the superior sensory nucleus for carrying touch and pressure, and the spinal nucleus for carrying pain and temperature from the area of the face. The fifth and seventh have very special relations, with each other. Here is the seventh nerve nucleus. To come close to that, it goes around the sixth nerve nucleus and comes close to the fifth nerve nucleus, because the sensory from the area, sensations from the skin of the face are carried by branches of fifth, and the muscles of the face are supplied by branches of seventh. Here is the diagram showing the area supplied by 5-1 ophthalmic division, the 5-2 the maxillary division, and 5-3 the mandibular division. The area of the face, paranasal sinuses, part of the nose, tip of the nose are all supplied by the ophthalmic nerve. Maxillary nerve supplies the region of the maxilla. The upper teeth are supplied, and the mandibular nerve supplies the lower teeth, skin of the face, mainly the region of the beard, which you see in the males. And here is the blue one, is the area supplied by mandibular. This area is supplied by maxillary, and this area is supplied by the ophthalmic nerve, including large part of the scalp. From there, these fibers go to the trigeminal ganglia. Trigeminal ganglia is equivalent to the dorsal root ganglia. Only thing is it is intracranial, and from there we have the sensory root. Sensory root is there, which goes to the superior sensory nucleus, spinal nucleus, mesencephalic nucleus. Fibers relay there, and they go to the opposite side of the brain in the post-central gyrus. So that is how pain from the areas of the face passes via these 3 nerves to the trigeminal ganglia, where they relay, go to the opposite side as the trigeminal lemniscus, relay in the thalamus, and go to the fibers from the right side will go to the left side cerebral hemisphere. This is the distribution of the fifth nerve, and sixth we have already done. The seventh nerve. Seventh nerve is the facial nerve. It supplies muscles of facial expression, and the skin of the face is supplied by fifth. Muscles of the face are supplied by seventh. Normally, the skin and muscles, underlying muscles, are supplied by the same nerve. Here, since the skin is so much, muscles are so much, so there are two different cranial nerves which are used for these purposes, but they come close to each other, not a bit in the skin, but in relation to the brain. The seventh nerve comes close to the fifth so that they can set up a reflex arc. The nuclear columns in the seventh nerve are the branchial efferent. These branchial efferent will supply all the muscles of facial expression, the muscles around the eye, the orbicularis oculi, the muscles around the nose, the huge number of muscles around the mouth, the levator anguli oris, depressor anguli oris, the levator labii superioris, depressor labii inferioris, and the important muscle, the buccinator. So these are all supplied by the branchial efferent column. Then we have the general visceral efferent, that is the superior salivatory nucleus, and even the superior salivatory nucleus and the lacrimatory nucleus. Lacrimatory nucleus is also related to seventh nerve. Superior salivatory nucleus, which supplies the submandibular and sublingual gland, is also related to the seventh nerve. Special visceral efferent, that is important. Special visceral efferent, the taste from anterior 2/3 of the tongue, except the circumvallate papilla. That means the taste buds which are present in the foliate papilla and in the fungiform papilla are innervated by the seventh nerve. Even the efferents from these areas, from the glands, are carried by the general visceral efferent component. And lastly is the general somatic efferent, which is there in relation to the ear, which may be there or which may not be there. I can show you this column, all these columns again. Here we have, this is the special visceral efferent column, the seventh nerve of the facial nucleus, the lacrimatory nucleus, the superior salivatory nucleus, the nucleus of general visceral efferent and special visceral efferent, the nucleus, this red one and the light blue one, this is the nucleus of Tractus solitarius, and last one is this general somatic efferent. So these middle 5 nuclei, there are 7. You leave this, the vestibulocochlear, and you leave the first one, the general somatic efferent. The middle 5 nuclei all belong to the 7th. Even 7th, 9th, and 10th, 11th, all these nerve carry these middle 5 nuclei. So this is coming to the 7th nerve, and this emerges at the lower border of pons, and it passes. This is the only nerve which uses 2 foramina. One foramen is this internal acoustic meatus present on the posterior surface of the of the petrous temporal bone, and other is the stylomastoid foramen. This is the only nerve which uses two big foramina in the skull, one from where one enters and the one which exits. Exiting one is the stylomastoid foramen and entering one is the internal acoustic meatus. Then it travels in relation to the ear, in relation to the vestibule of the internal ear, in relation to the promontory in a facial canal, and passes out through the stylomastoid foramen. This is the canal for the facial nerve. It first part runs laterally. There is a geniculate ganglia. It runs above the vestibule, above the promontory, and comes down vertically. It has a longer intrapetrous part of the nerve is there, and this is the intrapetrous part and exits through the stylomastoid foramen. Here we can see these five. We can see these nuclear columns. It passes through the facial canal on the medial wall. There's a geniculate ganglia. It gives branch which is known as the greater petrosal nerve. Then it gives nerve to stapedius for supplying the smallest muscle, the stapedius, chorda tympani nerve, which carries taste and which supplies the glands, passes through stylomastoid foramen. It supplies the posterior belly of digastric stylohyoid muscle, and then it runs in the substance of the parotid gland and supplies all the muscles, the temporal, zygomatic, buccal, marginal mandibular, and cervical branches. Here is the lower motor. Here is the course of the nerve. The passes to the nerve has a geniculate ganglia in relation to the ear. It relays in the fibers. From there, relay in this pterygopalatine ganglia, gives branches to the lacrimal gland, nasal gland, parietal gland, pharyngeal gland, and branches to the orbit. The mnemonic is M chordo, LMNOPP. So all these glands are supplied by this pterygopalatine ganglia. Then it gives fibers to the after relay in the submandibular ganglia. It supplies the submandibular gland and the sublingual gland. In addition, it also carries taste from the not the circumvallate, the foliate papillae, filiform and the fungiform papillae. It carries taste, and finally it divides into 5 branches, and before that it gives branches to the stylohyoid and posterior belly of digastric. The facial nerve paralysis is important. Stylomastoid foramen. There's a lower motor neuron type of paralysis. The face is divided into 4 quadrants: upper right, lower right, upper left, lower left. If facial nerve is damaged on the right side, the upper quarter and the lower quarter of the same side is paralyzed, and there are symptoms. The eye remains open. There is the tears flow. This nasolabial fold disappears. The lip angle of the jaw, angle of the lip becomes lower. The mouth cannot close properly, so mouth remains open. The saliva dribbling from here, the tears dribbling from here, and this side of the face looks longer. This is a very pathetic condition, but if it's treated in time, it becomes fine. So there's a paralysis of upper and lower quarters of the facial muscles of the same side. This is known as Bell's palsy, which is very often asked in the viva and very often asked in the theory as well. Coming to the 8th nerve, the vestibulocochlear nerve. The cochlear nerve is for hearing, and the vestibular Cochlear nerve is for hearing, and the vestibular nerve is for balance. The cochlear nerve starts from the spiral organ of Corti. There's a ganglia, and from there we have these cochlear nuclei. Cochlear nuclei relay. Cochlear nuclei relay in the olivary nucleus. They form lateral lemniscus and inferior colliculus. They go to medial geniculate body. Then they go to form auditory striations. Not optic striations are for vision. Auditory striations are for hearing, and they go to auditory cortex in the temporal lobe, area 41, 42, and 22. Here is the vestibular division. Vestibular nerves, they arise from the semicircular canal and from the utricle and saccule. आगे जाता है बोलो ना ये बार-बार आगे क्यों चला जाता है then they go to the vestibular nuclei. Vestibular nucleus is connected to the vestibular ganglia is connected to the vestibular nuclei, and vestibular nuclei are connected mainly to the cerebellum. Cerebellum is the one which is controlling the tone, posture, and equilibrium of the body. Coming to the, we have done the 8th nerve, coming to the 9th nerve. 9th nerve is glossopharyngeal. Glosso means in relation to the tongue. It is very important. It carries most of the taste from the tongue, from the circumvallate papillae, which have the maximum amount of taste buds. Then pharyngeal, it supplies the one muscle of the pharynx, that is the stylopharyngeus muscle, and it also forms a pharyngeal plexus in relation to the constrictor of the pharynx. So this glossopharyngeal nerve is the nerve of third branchial or pharyngeal arch, and it arises from the nucleus ambiguus and supplies the one muscle, the stylopharyngeus muscle. It has another column, the general visceral efferent column, which is the inferior salivatory nucleus, which is important, and it supplies the parotid gland via the otic ganglia. Then it has special visceral efferent. Special visceral efferent means it carries the efferent impulses from the tongue, from the tonsil, etc. That special visceral efferent carries taste from the circumvallate papillae. General visceral efferent, again, nucleus of tractor solitarius, is made up of two components, special visceral efferent and general visceral efferent. General visceral efferent carries the general sensation from the gland, from the carotid body, carotid sinus. And special somatic efferent is the spinal nucleus of the trigeminal, which carries the proprioceptive impulses from the muscle of the pharynx. It emerges between the olive and inferior cerebellar peduncle. There is a superior ganglia, superior ganglia, inferior ganglia. It gives a tympanic branch. This tympanic branch forms a plexus, tympanic plexus, lesser petrosal nerve, which relays in the optic ganglia and supplies secretomotor fibers to the parotid gland. It gives a carotid branch, which supplies carotid body and carotid sinus. Carotid sinus is baroreceptor, carotid body is chemoreceptor. It passes between the arteries, and here you can see the 9th nerve. This is the external carotid artery, internal carotid artery, internal jugular vein. Between the vein and the artery, there are the nerves 9th, 10th, 11th, and 12th. 9th is most anterior, 10th is behind, 11th is behind, and 12th is the most posterior. 9th nerve comes in 9th nerve. You can see the glossopharyngeal nerve. Glossopharyngeal nerve most anterior, passes deep to the external carotid, passes in relation to the tongue here, passes in relation to the tongue and tonsil, and supplies the tonsil. Supplies the tongue, and the tonsil supplies the carotid body, carotid sinus, and carotid body. It also supplies only one muscle, the stylopharyngeus muscle. It supplies the most important serous gland, the parotid gland. It also supplies the tympanic membrane. Coming to the 10th nerve, 10th nerve has also got the same nuclear columns. The nuclear columns are the nucleus ambiguous, which is partly from the 10th, gives fibers to the 11th, supplies all the muscles which I'll just enumerate. The red one is the general visceral efferent, supplying from the dorsal nucleus of vagus, and it is the one which supplies all the glands in the respiratory system and in most of the GIT system. The other one is the nucleus, again nucleus of tractus solitarius, which carries the taste from posterior most part of the tongue. This is the dorsal nucleus of vagus, which supplies the efferent fibers to the muscles and to the muscles and glands of the GIT. So this is the course of the 10th nerve, the branch supplying to the ear, branch supplying to the tongue, branch supplying to the muscles of the pharynx, muscles of the pharynx, and it also gives a branch to the carotid body and carotid sinus. So this is and it goes down to the heart, lung, and GIT. Vagus nerve has the biggest distribution in the body. It not only supplies in head and neck, it supplies less structures. Besides that, it supplies structures in the thorax, it supplies structures in the abdomen. And these are the nuclear columns, the same nuclear columns as the 7th and 9th, general somatic efferent column for the ear, the general visceral efferent, and special visceral efferent. Special visceral efferent is for taste. General visceral efferent is for the impulses from the glands. Dorsal nucleus of vagus is again efferent to the glands, and nucleus ambiguous is the one which is for the muscles of pharynx, muscles of palate, and muscles of larynx. The 11th nerve. 11th nerve is the accessory nerve. It is accessory to the vagus. It has got two roots, cranial root and spinal root. The cranial root, both of them actually belong to the branchial efferent column, the same nucleus as the nucleus ambiguous, and this cranial root joins the vagus nerve, and through the vagus nerve, it supplies the pharyngeal muscles, it supplies the muscles of soft palate, and it supplies the laryngeal muscles. Muscles of the pharynx are the three constrictors, superior, middle, and inferior, salpingopharyngeus and palatopharyngeus. Muscle of the palate are levator palati, levator villi palatini, palatoglossal, and musculus uvuli. Tensor villi palatini is not supplied, that is supplied by the 5th nerve. Tensor villi and palatopharyngeus muscle is supplied already amongst the pharyngeal muscles. The laryngeal muscles are cricothyroid, the tensor of vocal cord, the thyroarytenoid, the relaxer of vocal cord. Vocalis is also in relation to the tone of the muscle. Posterior cricoarytenoid. This posterior cricoarytenoid is a very special muscle. It is the only muscle which causes which causes abduction. These are the two vocal cords. Vocal cords are usually together. It causes abduction of the vocal cord. Vocal cords are together. It causes abduction of the vocal cord so that air can pass down. And this is a safety muscle, and it is a very important muscle. If both the posterior cricoarytenoid get paralyzed, person is not able to breathe at all. So this is a posterior cricoarytenoid out of all the laryngeal muscles is a life-saving muscle. Lateral cricoarytenoid is an adductor. Transverse oblique are adductors of the vocal cord. Aryepiglottic and thyroepiglottic. Aryepiglottic closes the inlet and thyroepiglottic opens the inlet. So laryngeal muscles, palatal muscle, pharyngeal muscles are all supplied by the cranial root of accessory. So the vagus nerve supplies the external ear and the meninges. Then it itself supplies the heart, lungs, and the GIT. The rest of the structures in the head and neck are supplied by the cranial root of accessory nerve. The spinal root of accessory, it rises, the name says the spinal root, it rises from the upper 5 segments of the spinal cord, passes through the largest foramen of the skull, passes through the largest foramen of the skull, the foramen magnum, goes up, joins the cranial root, but again it separates from the cranial root and passes in relation to the nerves here and enters the sternocleidomastoid muscle, leaves it, comes in the posterior triangle of the neck, runs in the facial roof and ends in the shrugging muscle, the trapezius muscle. So it supplies 2 important muscles of the neck. The sternocleidomastoid is a landmark muscle of the neck. So it supplies the sternocleidomastoid and it supplies the shrugging muscle, the trapezius muscle. This is the course of the 11th nerve. Coming to the last nerve, the 12th nerve. The 12th nerve is the hypoglossal. Hypoglossal means it has important relation to the tongue. It belongs to one column, the general somatic efferent column. It lies in the groove between pyramid and olive, and it leaves the canal through the jugular foramen. Through the hypoglossal canal. This is the hypoglossal canal, outer opening of the hypoglossal canal. Here is the inner opening of the hypoglossal canal. It enters the hypoglossal canal, comes here, and then it lies in relation to the various nerves, in relation to the carotid sheath, runs medially and supplies the muscles of the tongue. It supplies 7 muscles of the tongue. There are 16 muscles in this 3 inches long tongue, 16, 8 on each side. Out of them, 4 are extrinsic, 4 are intrinsic. Intrinsic muscles are superior longitudinal, inferior longitudinal, transverse, and vertical. The extrinsic muscle are the genioglossus, palatoglossus, styloglossus, and palatoglossus, genioglossus, and hyoglossus. Out of them, most important is genioglossus muscle. Genioglossus muscle arises from the genial tubercle of the mandible, passes back and goes into the base of the tongue. This is the only muscle which causes protrusion of the tongue, and it is a life-saving muscle. If a person gets drowned, the tongue has a tendency to fall back upon itself and block the posterior nasal opening. So this nasal opening blockage is prevented by the genioglossus muscle. So two important muscles are there, the genioglossus muscle and the posterior cricoarytenoid muscle. It passes and it supplies these muscles. If this nerve is, so genioglossus is only supplied by the opposite cortex. Rest of the muscles are supplied by the same side, ipsilateral cortex. If the right hypoglossal nerve is paralyzed, the tongue on protrusion goes to the right side. Tongue on protrusion goes towards the right side because the left genioglossus has pulled the base towards the left side, so that the tip of the tongue and the base of the tongue have opposite. If the base go towards the left side, the tip will go towards the right side. So here the tip of the tongue will go towards the paralyzed side. This one has to remember, and this is the 12th nerve. So we have finished briefly the 12th nerve, and only in relation to some of the nerves I have been telling you the applied anatomy, especially the ones which are asked in the examination and of which you see the patients. The 12th nerve is important, the 7th nerve is very, very important. Thank you.
Thank you, Krishna ma'am, for such a wonderful session. I hope it would be of great importance to all of you, and particularly for the students who are going to have exams in the near future, in the coming months or so. I would request all of you, now we are starting with the question answer session, and if you have questions, you can put across in the question answer section. And we have got some questions. Krishna ma'am, there is a question. Ma'am, please, will you teach about assessment of cranial nerves? I think it has already. How you go?
Partly I have done it, and partly assessment of cranial nerves will be done in your physiology practicals, because if you know the normal, you can you have to first know the normal. I have tried to stress upon the normal functions of the cranial nerves. If they are disturbed, you can assess them. The olfactory nerve is by the sense of smell. The optic nerve is by the field of vision. The third, fourth, and sixth nerve are by the extraocular muscles. Fifth nerve is by the sensation of ophthalmic, maxillary, and mandibular. Seventh nerve is by the, I told you about the facial muscles, muscles of facial expression. Eighth is by the sense of hearing, which are the special tests have to be done for the sense of hearing and for balance. The ninth nerve is for the taste from the posterior 1/3 of tongue. The 10th nerve is again from hearing, from the sensation, from the tympanic membrane and from the external auditory meatus. 11th nerve is for the trapezius muscle and the chin turning muscle by the sternocleidomastoid, and 12th is by the position of the tongue.
And second question is, can you first and second slides? You need to wait for a second, at least share this again.
Data. This is the first nerve. The olfactory nerve arises from the nasal mucosa. The nerves pass through cribriform plate of ethmoid, and then they form the olfactory bulb, olfactory tract, and the lateral olfactory stria, which goes into the anterior perforated substance and the uncus. This is the second nerve, the field of vision, the red and the blue. This is the visual field. The uppermost are the visual fields. This central one is the binocular zone. On the sides are the uniocular zones, and they pass through the retina, optic nerve, optic chiasma, optic tract, relay in the lateral geniculate body, and finally reach the occipital cortex, where illumination, color, three-dimensional images are seen.
Dear participants, I would like to tell you now on platforms. You can listen to this session at your leisure time, and then you can you want to listen this lecture again.
The sternocleidomastoid arises from branchial arch. The development of sternocleidomastoid is not very clear since it is supplied by the spinal root of accessory nerve. It could be developing from the fourth or the sixth pharyngeal arches. And these ones.
Ma'am, can you explain the reason behind consensual pupillary reflex?
Reason consensual pupillary reflex. Actually, I have not done the reflexes because pupillary reflex is constriction of the pupil. Constriction of the, when the light is thrown in the, say, the left eye, the pupil constricts not only of the left eye, but also of the right eye. As these fibers pass from the optic nerve, optic chiasma, or optic tract, some of the many fibers go to lateral geniculate body, some fibers go to superior colliculus and of superior colliculus and the nucleus of the third nerve of the left side as well as of the right side. So throwing light on the left, in the left eye, the impulses are going even to the right nucleus, and the pupil of the right side also constricts.
Please specify
The 11th cranial nerve has got two roots, as I've told you. The cranial root supplies the muscles of palate, pharynx, and larynx, and the spinal root supplies only two muscles, the sternocleidomastoid and the trapezius. If the spinal root is damaged, the person cannot, you can test this, the person cannot do this part, the shrugging part, and the turning the neck towards turning the chin towards the opposite side will not be possible. The cranial root, the muscles of pharynx, the swallowing part, the muscles of larynx are important, and if it is bilateral, then it is very, very serious condition. Since the larynx is the one which opens the vocal cords, and if both posterior cricoarytenoid are paralyzed, the vocal cords become adducted and the air cannot pass down.
Ma'am, is there any nerve zero?
nerve 0 or nerve 13. Yes, I don't remember, but there are few fibers which are said to be from nerve 0. I don't remember them.
Dr. Sumit, you can put your question across and ma'am will be like sending you the reply, the answer to your question. The queries will be put in, you just have to put this question on your social media handles.
Yes.
We will be happy to serve this. Ma'am, will you please summarize all trainer?
All cranial nerves supplies the region of the head and neck, including the heart, lungs, and GIT. There are third, fourth, sixth supply the eyeball. Third, fourth, sixth supply the eyeball. Fifth and seventh are in relation to face, skin of the face by fifth, muscles of the face by seventh. First is olfactory, sense of smell. So the orbit only has so many nerves. Second nerve is the efferent nerve, and the efferent part is third, fourth, and sixth nerve. So 4 nerves plus a part of 5th nerve also is in the eye, in relation to the eye and the structures there. First is here, second, third, fourth, 5th and 7th are here. 8th is here. 8th is here, the cochlear nerve and the balance part. When we are sitting, we are balanced because of the vestibular nerve. When we are walking, we have a balance because of the vestibular nerve. Ninth is for taste, maximum taste from the chaat pakodi, from the KFC, from all these shops is by the circumvallate papillae. 10th is mainly in relation to heart, lungs, and GIT. And it is there in relation to the external auditory meatus. If the pain is here, this is because the impulses are going from the external auditory meatus, and they may decrease the heart. So too much of syringing of the ear can decrease the heart. So one must, while taking out wax from the ear, one must be careful and not depress the heart. And second is the 11th nerve, the sternocleidomastoid and the trapezius, and the 12th nerve, the tongue. So if you remember these few words by your actions, first is nose, second, third, fourth, sixth are eyes, 5th and 7th are muscles, 8th is ear, 9th is taste, mostly the taste and the salivary gland, 9th. 10th is in relation to heart, lungs, heart, lung, and GIT. 11th is this sternocleidomastoid and trapezius, and 12th is hypoglossal. This is the least, this much one has to remember. And if one does the action, one remembers better. So I always promote that one should point on your own body, see on your own body, feel and do the movements on your own body or on your friend's body, so that you remember it for a longer time. So because it is doing which makes you understand and makes you remember for future.
I think you have already discussed the pathway of facial nerve in this summary. Right?
In the middle ear, it enters through the internal acoustic meatus, passes in relation to the ear. It passes in relation to the internal ear, and in the middle ear, through the middle ear, we can see a canal. This is a canal. So it is passing through the internal ear, but here there's a canal-like structure. There's a canal structure formed, and we see facial canal in the middle ear, and it passes at the junction of posterior wall and medial wall for some distance, and then goes behind and passes out through the stylomastoid foramen. So it has an important intrapetrous part, and this is the only nerve which uses two big foramina, the internal acoustic meatus and the stylomastoid foramen.
Ma'am, Sachin Alvade has told you very much for the brief summary of cranial nerves, a complicated subject. You will specify the functional components of cranial nerves.
The functional components, I have already done the 3 nerves which are difficult, 7th, 9th, and 10th. The other nerves are very simple, 7th, 9th, and 10th. Fortunately, follow the common middle 5 nuclear components. The 3rd, 4th, 6th, and 12th. 3rd, 4th, 6th, partly 11th and 12th have the most medial. So 3 plus 1, 3 plus 1, 4, 3 into 2, 6, 6 into 2, 12. So rule of double. 3, 4, 3, 4 ko chhod do, 3, 6, 12. Then the other one is the branchial efferent from the various arches. First arch is 5th nerve, odd number. First arch is 5th nerve, second arch is 7th nerve, third arch is 9th nerve. Third arch is 9th nerve, second arch is 7th nerve, first arch is 5th, 5th, 7th, 9th nerve. And if you see them, you see in one day, it is not possible. You have to see them repeatedly, draw the diagram which I have shown you. These are in the books, volume 4, and draw the diagram, colorful diagram. Black and white diagram does not help. Colorful diagram, then you will be able to remember it.
Ma'am, there is a last question, last question. What causes lead olfactory
Damage. Olfactory damage. Injury to this part of the nose may cause olfactory damage, or any hard poisons also can cause olfactory damage.
Ma'am, what
Cochlear nerve is the 4th nerve, and it only supplies one muscle, the superior oblique muscle. Superior oblique, when we are walking down the stairs, it causes adduction. So adduction in walking down is impaired, and the diplopia also occurs.
So we are done with today's session. We have almost, ma'am has given almost, replied almost all of your questions. And I would request the participants to just make this question answer session a little bit interactive in terms of the things wherever you know about the things, you can let other people to know about it. So I want, it has to be a both-sided conversation, so that we can make it more interactive and more as an educational platform where the knowledge and innovation will help all of you to understand the basic fundamentals of this subject. Thank you very much again. I am right now at now closing this wonderful session with Dr. Krishna Garg. We are thanking, I must say, Dr. Krishna Garg, would you like to say something to the participants before we end the session?
Thank you very much for attending this session. And I know cranial nerves are difficult, especially the course is all right, but the nuclear columns are the ones which are very tricky. So the first 1, 2, and 8 as one column. 1, 2, and 8 are one column. 3, 4, and 6 are almost one column. Fifth is again separate. 7th, 9th, and 10th, and 11th are one column. So you have to read at least 4 to 5 times with diagrams. Then you will remember, because cranial nerves are often asked in the examination. And from the practical point of view, again, cranial nerves are important. The detailed testing, detailed assessment of the nerves you will do in physiology practicals.
Can you give them some kind of mnemonic so that they can learn the nerves, which nerve for which muscle and activity? Or this can be a task to the participants.
Okay, this can be a task for the participants. If you do by actions, this is first, this is second, third, fourth, sixth. 4 nerves are here, 1 nerve is here. 5 and 7, this is 5 and this is 7. Okay, action. 8th is this, 9th is taste. The taste for the eating the ice cream and something which you like. That is the 9th nerve. Even 9th nerve, 10th nerve, and 7th nerve are for taste. 7th, 9th, and 10th, 11th is for shrugging and turning, and 12th is for hypoglossal. You want to tease somebody? So that is a easier way. If you do by actions, you remember it for the longer time, and you have fun also. You tease each other, and you do the actions, and you learn better. So by doing actions, anatomy is by actions, all the muscles. You can do action of the muscles and remember them. Thank you.
Thank you, ma'am. Once again, I had told you that ma'am has her own ways of teaching you. So I would request all of you to learn what ma'am has told you, that how can you keep the anatomy for the retain the anatomy for the longer time. Use your bodies, the physical bodies of yourself and your friends wherever you are. So, and the bones, the models of the bones with you, so that the learning becomes so easy for you. That is basically the fundamental idea of CBS Author Talks. So once again, I thank you, all of you who have participated today for this very important session, and because the reason behind this was to prepare our exam going students. And I hope you must have learned something for this. And for any other questions or any queries regarding this, you can let us know on all your social media platforms. Put the questions across, and I will ensure that your questions are answered on the time by ma'am herself. And again, thanking you all of you, the esteemed participants, the panelists, and the people who are watching this and who have participated in the question answer session. Equally delighted and thankful to all my CBS ambassadors, my colleagues, my marketing team, and entire CBS sales and marketing team across India. I would also like to thank you, Mr. Y. Arjuna, the publishers, and also like to thank you, Mr. Varun sir, Mr. Mata sir, for having a faith in me to conduct such kind of author talks, CBS author talks. And I would also like to thank my team, my co-colleague, Ms. Simran, Daljit, and Neetu for providing us all the support in making this CBS Author Talks a wonderful session today and tomorrow. Thank you once again. And I wish all of you a very best of luck in your exams, for your exams. And I would request all of you stay tuned with us for all upcoming programs in CBS and CBS other initiatives. Thank you once again. Namaste. Have a great day and have a great Sunday. Thank you. Thank you very much all.